I'm Karen Bloor. I'm acting research team champion for Health and Wellbeing, but not for very much longer. And it's a real joy to have Joy. Oh, there you go. So I didn't even realise that was fun until I said it out loud. It's a delight, let's say, to have Joy Adamson join the research champion team and take over very shortly. But we thought it was a bit unfair before she even started the job to get her to present what's going on so far and her ideas for the future. So we're going to have to get a feet under the table at least. And at the moment, the priorities that I've been working on over the recent months and years are summarised in this graphic. And so what I've been trying to do is work on bridging fundamental and applied health sciences, on developing interdisciplinary approaches to wellbeing across the life course, on mental health and on global health. And I'll just give you a couple of just highlights, I think, from what we've been doing in those areas. So in terms of bridging fundamental and applied research, I think this comes from a position of strength, but also a bit of a gap in York. So historically, we've had really strong fundamental science departments and fundamental health-related research in places like biology and chemistry and psychology. And we've had really strong applied health departments, such as the Centre for Health Economics, Centre for Reviews and Dissemination, and some of the applied research that goes on in the trials unit and in the rest of the health sciences and related departments. But partly because we didn't historically have a medical school, obviously we do now, and that's a real help to bridging that pretty much gulf between what goes on in a lab and what goes on in the health service. So now we have the Hull York Medical School, but historically we haven't had that. So I think we've developed these strengths at both ends of the pathway, but not always joined them together. So what I was hoping to do as research champion was to encourage a little bit of communication between those two ends of the clinical pathway, and obviously incorporating medical researchers and clinical researchers in the middle. So there's been quite a lot of activity over recent years in that area. We've obviously had the creation of the York Biomedical Research Institute, which is a great way of enabling interdisciplinary biomedical research, but it also gives the rest of us a chance to sort of conduit to contact biomedical researchers and to get in touch with the people that we need and that work in areas that might be related to our own. Partly as a result of the creation of IBRI, we've got increasing and developing partnerships with local NHS organisations. We always work with York Hospital and with other local hospitals like South Tees, but we don't work with them enough, really. And I think there's more we can do with our local NHS partners, and increasingly with other health partnerships as well, like, I don't know, I mean, while they still exist, the clinical commissioning groups, obviously they're going to disappear or be merged into integrated care systems unless Matt Hancock has taken the NHS bill with him on his Gmail account. But assuming that the white paper, the NHS white paper, does get converted into a bill in the next couple of weeks, we're going to have a new set of NHS organisations to work with. But again, that could play to our strengths in terms of integrating health and social care. And integrating health and social care research is something that we need to do in the university and do more of. So we have developing partnerships with our local health organisations and health-related organisations. I think bridging those two areas is increasingly clear through the research grants, the applications that we make and the grants, the success that we have. So we've got physics and electronics working with health economists and clinicians on imaging, diagnostics, near-patient testing, and some of us at the applied health end going on our first engineering and physical sciences research applications. So EPSRC applications from applied health researchers, which is really new, at least to me. We've got clinical and applied health researchers working with neuroscientists and other biomedical scientists on mental health. And we've got applied researchers working with computer scientists on digital health. These are just a few examples of where we can work right across the span of fundamental and applied research in the area of health and wellbeing. So my second graphic there was on mental health at York, and you'll be aware of this as interdisciplinary research strengths. We have substantial volume of research in all kinds of departments on mental health, health sciences, health economics, CRD. We have a Cochrane group. We have psychologists, education, people in social policy and social work, some of the arts and humanities groups, health histories. There's all kinds of strengths in mental health right across the university, and we've been working to bring those together, and there's likely to be creation in the future of an interdisciplinary institute of mental health research. We have strong partnerships with local care providers, particularly Tees Eskom Wear Valley, which is the biggest mental health trust in the country, certainly in terms of geography, and with national organisations like the Mental Health Foundation. And we have a developing agenda around student mental health research, including the creation of a student wellbeing cohort, which hopefully will give us a chance to do lots of development and testing and evaluation of interventions with our students on to support and improve their mental health. In terms of wellbeing across the life course, well, I mean, this is a huge, priority, but we've got considerable new research going on in that area. We've got great research on child's health and wellbeing going on already, interdisciplinary research in the Born in Bradford cohort, for example, and in other areas of early years psychology. One of our colleagues in psychology, Elena Djangu, was very recently awarded a Welcome Leap Award looking at the first 1,000 days of life. And there's all kinds of exciting work going on around child's health and wellbeing. I think we have increasing interest in the health of working age adults and health in workplaces. And there's researchers working across York Management School, health sciences, social policy and social work, economics, and others in the area of working age health and health at work. And that feeds into the prevention of future health problems and therefore into healthy aging. And we've had some really interesting discussions across the university around aging. I think this is a real area of strength for future development, and one that I know that Joy is interested in taking forward. And all of that relies on the importance of prevention at all life stages and indeed in life transitions. I think that sort of transition between perhaps childhood, adolescence, adulthood, retirement, there are these sort of perhaps transition points that I think we could develop some research in. So there's work going on in that area. We've got we've heard from Jane and from Rachel of things that could work across different areas of the university and across different research themes. I think the link with the environment there in terms of health promotion and prevention is really important, and not just the natural environment, which is automatically good for our health, particularly when we're out in it and physically active in it, but also the cultural environment in which we live and the built environment in which we live. And I know that Nicholas and others are interested in housing the built environment as well. So loads of potential and developing interest in that area. My final one was on global health. We've got huge strengths in interdisciplinary global health research in all kinds of areas, infectious diseases, including the neglected tropical diseases, lots of work going on in Matic and Ibri. We work in global public health, in global health economics and global health histories. And research teams work together across the university in some really important and substantial global health research projects. But of course, there are the current challenges of GCRF funding being withdrawn and or withdrawn from many research councils. So we need to find ways of maintaining and developing that whole area and the important, really crucial work that's going on in that. So what's next? Well, not my job to say, really. What's next is going to include Professor Joy Adamson, who you've heard from. Rachel, her strengths, I think she's going to make a fantastic research champion.